I think the thing that really took me by surprise with this was after getting laid off from my job and losing my health care coverage and then not being able to get COBRA, calling around and calling the different private providers, and as soon as I said what my situation was, forget it. Absolutely wouldn't even go any further with it. I have hydrocephalus. It's water in the brain. There's a tube that I have that goes from my head, drains the fluid down into the abdominal area. Once the shunt was put in, everything's fine. I'm functional, normal, good to go. I have to have a neurosurgeon look at it, check it, make sure everything's working right. I see the doctor once a year. I have a neurologist that I go and see. So as long as it's functioning normally, I'm functioning normally. There's all of these tests that I have to have done routinely every single year, and sometimes once every 6 months, and without insurance this is impossible. It's impossible to even imagine how much these tests cost. I've gotten CT scans every year. I get MRIs. I mean, those are, even looking at the cost of them on the insurance paperwork when I had insurance was, thousands of dollars. That's not something that I can pay. The thing that really scares me is that by the time I show any kind of symptoms of anything being wrong, the shunt will have already stopped working. That can cause brain damage, and that would end up with me going to the ER, having emergency surgery. That's, without regular monitoring, I run a real risk of, something serious happening, and that scares me.